What is the patient profile? We know the endometriosis in 25% cases they will actually have no symptoms. Endometriosis is definitely a reproductive age group problem. It will definitely present in the reproductive age group because it is a hyperestrogenic condition. Okay, so 25% will have no symptoms at all. They will be asymptomatic, just like adenomyosis. 33% are asymptomatic. Then the age profile is around 30 to 45, depends upon whether she's having endometriosis of the tubes, of the ovaries, or it is adenomyosis, because the adenomyosis is generally presenting later in life. But the other endometriosis might present at the age of 25, 30, 35, all right? 15 to 30% patients are infertile. As I told you, the incidence, the prevalence of endometriosis in infertility patients is around 15 to 30%. Otherwise, in a general population, it is only 10%. Okay? Now, it may be in the nullipara or in a multipara. There is no as such demarcation or high risk factor whether nulliparas or multiparas. But obviously, it is a hyperestrogenic condition, so it will be more common in the nulliparas rather than the multiparas. Okay? Then, symptoms are directly related to the depth, okay, but they are not related to the site. They are not at all related to the site as to where it is happening. They are not related to the number of lesions, not related to the site, not related to the number, and not related to the size of lesion. Okay, it has no relation, the pain, the symptoms. It is only related to the depth, how deep it is. Okay, so it is mainly related to the depth and of course rather than the spread of the disease. So just like the AFS classification that I'll be telling you, American Fertility Society has classified endometriosis, but it does not actually give any insight, any idea about the symptoms and how to manage, because the depth and the size and all, they all differ. So the site and the size and the number of lesions have no correlation with the symptoms, so it cannot help us in the management. Now, when the depth is more than 5 millimeters, the symptoms are more. So it is said that if it is more than 5 millimeter depth, then it is a deep infiltrating endometriosis, and obviously the symptoms, the pain will be more. Okay. Now I have highlighted here non-pigmented lesions and midline lesions. These are the most painful one. The non-pigmented ones are the ones which are not powder gunshot appearance or the powder burn appearance. These are not the ones which are very painful because these are the superficial ones. The non-pigmented ones are the deep infiltrating ones. Okay, we discussed in the chapter on endometriosis causes and symptoms that the superficial ones will have some color, like it might be an old lesion which is a powder burn bluish blackish appearance, or it might be a red flame appearance, that is a new lesion where the macrophages are still trying to ingest the RBCs. So these superficial lesions are not as painful as compared to the non-pigmented lesions. The midline lesions will be more painful, like the uterosacral, the pouch of Douglas. These are very painful depositions of endometriosis.